welcome you to this virtual open house. And I'm going to transition now to sharing my screen and introduce you to some of the attributes of our school and our graduate program. So, as the slide mentions, doing public health good starts here at the University of Maryland School of Public Health. So our school is located in College Park, Maryland, which is right outside of the DC metro area. It is the state's flagship university and one of the nation's leading public research universities. It's a short metro ride to the nation's capital, Washington, D.C., which gives us unique and unparalleled access to the leading health research, policy, and advocacy organizations. And our students have this amazing ability to gain hands-on experience with a number of these organizations, and we'll talk more about those. The College Park campus is a beautiful campus, and we're located on the northern end of the campus. Normally, we would be providing virtual tours of our space, but we're going to include plenty of pictures today, so hopefully you can get a feel of the school and the campus if you haven't been there before. My name is Steve Roth. I am the Associate Dean for Academic and Faculty Affairs, and I'm joined today by Britt Saxvig, our Director for Graduate Student Services, and Lana Duarte, our Recruitment and Admissions Coordinator. Many of you have probably already heard from Britt and Lana in your interests with our programs. At 12:30, you'll have a chance to meet our Dean, Boris Lushniak. He comes to us from a long career in federal public health service. In particular, he was in the U.S. Public Health Service Commission Corps for 27 years, served as the Deputy Surgeon General for 5 years, and served as the Acting Surgeon General of the United States for 2 years. He has a bachelor's and doctorate from Northwestern and received his MPH from Harvard University. So many of you are asking, why choose public health? Well, you're here because you have an interest in public health. And certainly what we are seeing in the current pandemic situation is that public health matters. Public health matters in a visual way sometimes, like now, but public health happens more often behind the scenes. Public health is affecting our ability to prevent disease and improve population health as much as possible. The School of Public Health is driven by a passion to break down the societal barriers that keep individuals, families, communities, and populations from optimum health and wellness. So taking a look at the School of Public Health students, from our most recent class, you can see that we have a large population of students. We have one of the largest undergraduate populations of any school of public health in the nation, which provides a unique opportunity for graduate students to mentor our undergraduates. And it provides a number of unique opportunities for community engagement in public health. We have one of the most diverse student bodies on the campus at the University of Maryland, with about half of our undergraduate and graduate students being students of color, with a majority of states in the United States represented, as well as 62 countries around the world. Many of you are probably curious about our response to the COVID pandemic. We have a plan called For Maryland and a website, umd.edu/4Maryland. And so we are following all of the public health practices that are being recommended, and our School of Public Health is helping inform the campus response to COVID-19. With regard to classroom instruction, this year, most of our courses are 100% online. A very small fraction have in-person components. So most all of us are working from home, and most of our students are attending classes from home. And we will continue to see that through the spring. It's early to tell right now what the fall semester will look like, but rest assured that we will be following the guidance of the CDC, and depending on the state of vaccination and overall infection rates, we will be making decisions in the summer about how to proceed safely for the 2021-22 academic year. We have 6 different academic units in the School of Public Health, all of which host different graduate programs. And so we will talk through those different programs a little bit, and you'll have a chance over the next couple of days in this virtual open house to visit individual programs that you might be interested in. Our school also hosts a number of research centers. We host one of the only centers for health literacy in the country, the Horowitz Center for Health Literacy. Our Maryland Center for Health Equity is focused on reducing health disparities. And we have a number of other research centers that you can read more about on our website. As I say, normally we would be meeting in our main lecture hall today to give you an overview of the school, and then you'd have a chance to tour around the school and meet different people and see some of the sites. And we're sorry that we can't provide that for you. We have a virtual tour video that's available, and we have other resources for you to get more information about the school while we're in this virtual space. One of the things that we talk about when we talk about our graduate programs is what we call the Maryland experience. And this really comes down to 4 factors that we think set us apart from our peer schools of public health and other graduate public health programs. And that first factor that we think of is really our location. The fact that we are located within the Washington, D.C. Beltway gives us unparalleled access to a number of different federal agencies, nonprofits, for-profit industries, as well as state and local public health organizations. This map, which shows a number of these organizations in and around the DC region in Maryland and even into Virginia, shows places where our students have performed internships or research opportunities. Effectively, our location is an unfair advantage. There are very few students in public health who have the ability to access so many different types of public health and health-related organizations and agencies. And the fact that we are on the DC Metro provides students with easy access to these different opportunities. And so we encourage all of our students, some of whom are required to have internships if you're part of our MPH or MHA programs, to engage in these direct experiences and start building your resume as soon as you walk in our doors. In addition to our location, we take pride in our academic excellence. We set high expectations for student success, and we provide exceptional support for students through advising, career development, and co-curricular programs. We have a relatively small student body for a graduate school, and that allows our students to have strong access to our faculty, whom they get to know on a close basis. When we consider the university that we are a part of, it is one of the most innovative schools, one of the largest public research institutions. The School of Public Health is also accredited by the Council on Education for Public Health and has been accredited across all of our programs since 2010. The third thing that we see that I think is unique to our School of Public Health is our authentic community connections. Our partnerships with local and global communities give students the opportunity to develop unique access to practicing public health and researching public health. SPH faculty have many community partnerships, and I'll highlight a few. I won't spend time talking about the many ways that our students are engaged in the COVID-19 crisis, Many are volunteering as contact tracers, they're interning at local health departments, and supporting faculty research to help understand and stop the COVID-19 pandemic. So some of the events that our students participate in, one is the Mission of Mercy and Health Equity Festival that we hold every 2 years. It's in partnership with Catholic Charities, and the Maryland State Dental Association provides free dental and health care for thousands of underserved and underinsured adults. We fill our Xfinity Center basketball arena with dental chairs. It's quite an experience. Many of our students are participants in the Public Health Beyond Borders student group, which works with global communities to improve public health. In particular, we have sent students to Peru, Ethiopia, India, and Sierra Leone, as well as local communities around the University of Maryland. When we look across globally, we see a map of many different global connections where our students and faculty are engaged. We have the Global Health Initiative at the School of Public Health that is engaging our faculty and providing additional opportunities for students. More locally, we work with a number of nearby community organizations to serve underserved communities in our backyard. This is an example of Comfort Cases, which is a partnership with the school to provide personal care items for youth within the US foster care system. So these are just some of the examples of ways that students can remain engaged in public health as they are continuing their academic programs. And finally, the other thing that we are most proud of is our research programs and our world-class faculty. We have faculty who are involved in research, education, policymaking, and service in Maryland, nationally, as well as globally, with research spanning the breadth of public health. And as I mentioned, our relatively small graduate programs gives you ready access to these leaders in their fields. I want to highlight a couple of the studies that are going on right now. Here's a picture of Dr. Don Milton, who is getting a lot of national press because of his Stop COVID-19 study. He is an expert in infectious disease and especially how infectious disease spreads through the air. And he has been one of the leading voices in helping us understand how COVID-19 is spread through aerosols in the air. Beyond COVID, we have a major interest in climate change and public health in the school. And one of our centers is known as the Conserve Center for Sustainable Water Reuse, Food, and Health. They are examining how water reuse can improve our use of water and improve the stability of food and irrigation of food sources, especially during times of drought. Our Prevention Research Center is a CDC-funded center that is working to understand mental health concerns in LGBTQ people through research, service, and training. A number of our faculty are interested in understanding vaccines and vaccine distrust and misinformation. We are interested in, especially in relation to the COVID-19 pandemic, how can we stop the spread of vaccine misinformation and improve vaccination uptake around the nation. In our Department of Kinesiology, Dr. Carson Smith is leading the Exercise and Brain Health Initiative in an effort to find ways to reduce the effects of Alzheimer's disease. These are just a small number of the studies that are going on around the campus. You have a chance to visit our website and find other ways that students are connecting with faculty and other communities in the School of Public Health. A little bit more data about our school. If we look at our most recent graduation data, we see a 95% placement rate for our Masters of Public Health, Masters of Health Administration, and Master of Science graduates, 88% of whom are employed after graduation, and 7% move on to continuing education. Many of our students are employed as part of their internship. That's why it's so important to get those quality internship experiences. We have a 100% employment rate for our PhD grads. When we look at our alumni data, where are our graduates working? And you can see from this graphic that a number of them are working in academic institutions, federal institutions in particular, given our location in the DC Beltway. Our alum work for healthcare organizations, state and local governments, as well as for-profit and not-for-profit organizations. So you can see that our graduates have a breadth of experience as they come out of their programs, and that opens doors across a breadth of organizations. As we consider our degree options, many of you are here because you're interested in the Master of Public Health, which is the leading public health degree. Our Master of Public Health program offers 8 different concentrations in behavioral and community health, biostatistics, epidemiology, environmental health sciences, health equity, health policy analysis and evaluation, physical activity, and public health practice and policy. Public health practice and policy and behavioral and community health are both available as fully online degree programs, which may be of interest to some of you. These MPH programs, as we describe them, are 45 credit programs and include 14 credits of core courses that you will take as a cohort across all of the different concentrations. All of the MPH programs also require an internship program as well as a capstone experience. We accept full-time and part-time students, and our courses are typically after 4 p.m. to accommodate working individuals. In addition to the MPH, we have the Master of Health Administration, which is also a 45 credit program. It similarly is offered as both an in-person and an entirely online degree program. We also have other research-based masters, including the Masters of Arts in Kinesiology, Master of Science in Environmental Health Sciences, and we have a Master of Science in Couple and Family Therapy in our Department of Family Science. We have a couple of dual degree programs as well. For any of our undergraduates who might be out there, we have our BS to MPH accelerated degree program. We have several students who have taken advantage of that pathway. We have a dual degree program with the School of Architecture, Planning and Preservation, and their Master of Community Planning, which can be combined with any of our MPH concentrations. We also have a dual degree program with the School of Medicine at the University of Maryland in Baltimore. For those of you interested in our doctoral degrees, we have 7 different PhD programs that match all of the academic units within the school. We have a number of graduate certificates as well. The Principles of Public Health, which is an online certificate program, Global Health, and Gerontology. We see many of our MPH students add the Global Health Certificate, which is a 12 credit program, as an addition to their MPH in order to gain additional experience and expertise. At this point, I'd like to transition and introduce Dr. Britt Saxvig, our Director for Graduate Student Services, who will talk through the application process for our graduate programs.
Hi, everyone. Welcome. And I'm just going to talk about the SOFIS application process and the Maryland application process. Some of you may not have started yet. So the beginning of the application process is to kind of identify the program. Today's a great day if you're not decided which program fits what you want to do. The open house is an opportunity to meet with our graduate directors and faculty and students from all of our programs. And at the open house agenda, you can see where the time and the schedule for the individual departmental sessions will be held. So it's really identifying the program that you want to apply to. Once you do that, you can go into SOFIS and start your SOFIS application. The requirements for SOFIS that we've set is that we need 3 letters of recommendations, TOEFL, English proficiency test scores if you need to do that as an international student. We are not requiring GRE scores this year. The only program that requires a GRE score is the PhD in Health Services Research. All of our other degree programs will not require GREs. We need transcripts from your undergraduate or graduate institutions, and they must be official transcripts that are submitted to SOFIS, a statement of purpose, and your resume. You may also include a writing sample or a publication if you do have that. So the SOFIS process is once you've submitted your SOFIS application, it'll move through the SOFIS system. And so when you first start it, it's considered in process, then you submit. And when all your materials are in, that includes the transcripts and at least 2 recommendations, it becomes complete, and then SOFIS will begin to verify your transcripts. And once that verification process takes place, it could take 1 to 4 weeks to complete the verification process. Once that's done, you will receive an email from me or the admissions team to say that it's now time that you can start the UMD portion of the application process. And the UMD supplemental application is in what's called the TERP-Engage system. And you'll receive an email notification to go ahead and start that. You start that application in the UMD application portal. Basically, they're looking for residency information, demographic questions. You do need to upload a copy of your statement of purpose that you submitted in SOFIS. And also upload unofficial transcripts for the graduate school and then pay the fee. And once that's done, your application will be moved to under consideration or under review, and you will receive an email from me again saying that your application is now under review in SOFIS. Now, each individual program has their own application review system. And so that will take place. And then once that review committee has made a decision, your application will change and a decision will be made. Final decisions on your application, you'll receive an email from the graduate school to go into your application system in TERP-Engage to view the decision. At any time, if you have questions, you can reach out to Lana or myself, and we'll give you our contact information during this entire application process. But you will be getting emails that when you change a status in SOFIS, you will get an email letting you know that that status has changed. And our deadlines are here. So we encourage everyone to submit their application by the best consideration date. And the best consideration date are the ones that are early in the system. And because your application will then be reviewed in the first batch. After that best consideration date, the application will be reviewed on a rolling basis. And if there's space permitting, applicants will be accepted. So I encourage everyone to submit by the best consideration date. So online MPH and MHA programs for spring 2021, the SOFIS deadline is October 16th for best consideration. And then the UMD TERP-Engage supplemental application deadline would be 11/13. For the PhD programs, the best consideration deadline is November 13th, with the Chirp Engage deadline of December 11th. And then our MPH, MHA, MS, and online programs for fall 2021, the best consideration deadline for fall is December 18th, with the Chirp Engage UMD supplemental application deadline of January 15th. Again, if you have any questions at all, you could reach out to Lana and myself. Now, we're going to go into some question and answers as we're waiting for Dr. Lushniak. I'll hand it back to you, Steve.
Great, thank you, Britt, I appreciate that. So I can't see everybody here, so Boris, when you are on, you give me a heads up. So we will transition here shortly to introducing Dr. Boris Lushniak, our School of Public Health Dean. At any point, you can continue to use the chat function to ask questions, and then we will also allow you to raise your hand so we can have you open your mic and ask questions in that way as well. And just a reminder for everyone, if you can include your name and the degree program that you're interested in your name, then in your Zoom screen name, then we can prepare for our breakout sessions, which will start here in 30 minutes. In the meantime, while we wait for Dr. Lushniak to get online, let's go ahead and open it up to any questions that people want to ask at this point of either myself or Britt. You can go ahead and use either the raise hand button, or you can just go ahead and speak, or you can include your information in the chat.
So we have an applicant that's interested in the MS and family science.
That's great. I don't remember the schedule offhand for when Family Science is hosting their departmental breakout over the next day or two. Britt or Lana, do you have that information?
So the department is focused on the clinical work they are doing with their students, so they are not hosting a session at this time, but I will share the information from Dr. Marian Moses-Jones, the grad director for the program in the chat box. And Samaya, the MS Family Science application is a one-step application. You don't need to apply through SOFAS, it's only through Chirp Engage. I shared this information a little earlier in the chat box.
Okay, so do you hear me?
Yes.
Hello. Yeah, good morning. Yeah, thank you. So actually, I have a couple of questions for the MS in Family Science. So what is the TOEFL requirement for that? Because I just went through the website and that was the general requirement for all the concentrations. So I want to know that actually what is the minimum requirement for this program?
Britt, do you want to take that, or?
Sure, and I'm very sorry because I was just sending an email to Dr. Lushniak. Could you repeat the question?
Oh, I'll take it. So,
okay.
Samaya, I don't believe that our Family Science program has a different lower standard than the typical campus standard. In all of our application reviews across any of our programs, we take a holistic approach. So while you have to have the minimum campus standards, our faculty admissions teams are going to be looking at the breadth of your application. So some of these specific questions you might want to reach out to the graduate director within Family Science. I hope that helps.
Okay, and I have just one more question. I'm sorry.
Oh, that's
please. So is that fine that I can contact the professor before application, or I have to apply first, like everything is from the central admission?
No, we encourage you to reach out to the graduate directors in advance of your application to ask questions. Absolutely.
Okay. Yeah. Thank you so much.
You're welcome.
So we have a question about the application deadlines. So the SOFAS deadline for best consideration and the final, it would be good to have your SOFAS application verified by that deadline, because that means that it can immediately go to the graduate school for you to start doing your UMD application. If it's close to the deadline, then it will take longer for you to move through and for your application to be reviewed. You do not need to have your application verified by the SOFAS deadline, but it's highly encouraged that you do have that. So to submit your SOFAS application at least a week before the deadline is encouraged. And there was another question about students. Some of you may be advanced special students taking one of our classes this semester. So you may wait. Unless there's some reason that you want to wait and make sure that you have an A in the class because it's offsetting your GPA or something else, you can go ahead and start your application in SOFAS, and then once you finish that class, that grade will be posted, and you can submit an updated transcript to your application. So that's if you apply before that grade is posted on your transcript. So if you wait to apply, then the official transcript will have that grade on it, if that makes sense. So you just want to make sure that the transcript with the grade for that course is posted in your application.
Hi, this is Sylvia Costa. You had just addressed my question in regards to the final grade. I guess my question really revolves around when the appropriate time is to submit SOFAS if I am waiting for that final grade posted in the transcript. Because I was advised to submit my application in January, and now I'm not sure if that's the UMD application or the SOFAS application. So should I submit my SOFAS application in December and then submit my updated transcript with that final grade from the fall in January through the UMD application? I guess.
So you were talking to Dr. Turner?
That's correct.
You can get your application submitted, and I would recommend that you get your application submitted as soon as you can, if that's what your plan is to apply. And then you can update your application later with your grade from the course. But Dr. Turner, when you go to his session, I believe it's tomorrow, you may just confirm that with him if he's the one, because he is in charge of the admissions committee for that program, and can give you more specific information.
Thank you.
Mm-hmm.
Great, Britt, I'm finally on.
Good.
Dean Lushniak, welcome, and thank you for joining us. We've got 36 or 7 prospective students here who are interested to ask you a few questions and hear some of your welcoming words. So thanks for joining us.
Great, thank you for the delay. I, of course, ran into some technical issues of trying to get on board. So anyhow, I'm finally here. And first of all, welcome to all who are on. We have now a total of 40 people on. Obviously, some are from faculty and staff within our School of Public Health. But the most important people on right now are really those who are interested in evolving into something that they pursue, right? You wouldn't be here if you weren't, 1, inquisitive, 2, obviously looking for change in your life, 3, looking for a challenge, 4, looking for an educational pathway that gets you to where you want to be. And it's with that sort of that I certainly welcome you. It's one of those things when you kind of look at advanced degrees, right? All of you have a common thread in that you have at least a bachelor's, maybe some of you have a master's, maybe some of you have other doctoral degrees. And what we offer at the School of Public Health at the University of Maryland is the next stage of that education, right? Let me tell you a little bit about myself and how I ended up as the Dean of the School of Public Health at the University of Maryland. I've been Dean now for 3.5 years. So on a relative scale, secretly, I'm kind of a newbie still at this. right? I'm kind of new, and this actually was going to be the year where I sort of come out of my turtle shell, so to speak, right? Terps, as you know, the terrapin is a turtle. And the reason I say that, it actually took me about 3 years to figure out what it means to be the dean of a school of public health. I came into this as a public health practitioner, for want of a better term. I'm trained as a physician initially, so I have my MD degree. In 3 different specializations along that pathway. I started in family medicine and then expanded that to include preventive medicine, specifically the field of occupational and environmental health. And then expanded once again to a new realm, which was dermatology, and sort of combining things was my initial 16 years of my professional career was with the Centers for Disease Control and Prevention, specifically within the National Institute for Occupational Safety and Health, where I ultimately became the skin guy, right? The one who was looking at health effects of the environment, occupational environment, and other environments on the health of the skin. An intriguing pathway for me because, you know, and perhaps many of you are in that same situation. If someone had predicted, right, years ago when you were in an educational pathway where you would end up now, or even predicting into the future where you're going to end up in 5, 6, 7 years from now, I would have never sort of said, oh, this is what I want to be. There was an evolution, and perhaps many of you are going through that evolution right now, which was I was always intrigued, even though I was in the medical field. And all of you know that that concept of the medical field is what? It's really built around the patient-physician relationship, right? You take care of one person, you talk with them, you diagnose where necessary, you go through therapeutics where necessary, and you ultimately have a conversation with that single person. I was intrigued in the field of public health because that essence, that one-on-one becomes still a one-on-one, but now the other one is not a single patient, but is the population. And I was intrigued with the idea that ultimately, if I'm going to make a difference in this world, it's really dealing with population health more so than individual health. But both play a key role. I, remained a clinician for many years of my career. So 16 years at CDC and NIOSH. Switched over from there to the Washington, D.C. area. And those 16 years, most of them were spent in Cincinnati, Ohio at the NIOSH laboratories there, working on a variety of things that spanned everything from occupational investigations as part of their health hazard evaluation program, covering the span of all 50 states, going out into the field, usually as a team of an epidemiologist or a epidemiologist medical officer, or those 2 professions in addition to an industrial hygienist, and investigating workplaces. Where there are diseases, where there are other issues appearing, are there exposures, and what can we do about what? About preventing things. During that time span, I was an officer in the U.S. Public Health Service Commission Corps, so I wore the uniform of one of the services of this nation and was proud to do so. Was deployed to Kosovo during the war, or pre-war Kosovo, to deal with refugee health issues. So I was also part of a bigger cadre, trained as an epidemic intelligence service officer, and then went on to other deployments, including the World Trade Center, so in New York City for about 2 months, right on the cusp of the tragic events dealing there with occupational environmental health issues. Came back home for a few days, was deployed to anthrax as part of the responders from the CDC, and then made a switch to the Food and Drug Administration after 16 years at CDC to work in an office called the Office of Counterterrorism and Emerging Threats. That led me down the pathway to ultimately become a flag officer, a rear admiral, first a 1-star, then a 2-star in that process. So I started as a young lieutenant, and I ended up as a more older and mature rear admiral. In that pathway, also more deployments, Hurricane Katrina, seeing the reality of what goes on in natural disasters, and obviously being a leader 10 years ago during the pandemic of H1N1. Made a final switch in my career when I was asked to step into the role of Deputy U.S. Surgeon General of the United States, and served in that role for 5 years, 1.5 years of that as the acting U.S. Surgeon General. What happened during that time span? We released the 50th anniversary report on smoking and health. So you can tell that the expansion to bigger public health issues continued through my career. Again, not predictable events, but one that I certainly took on with enthusiastically. Transitioned also in that time period to work on the first ever call to action from the Surgeon General's office on skin cancer prevention, bringing 2 of my areas into the public health realm. And then ultimately being also deployed for about 3 months to Liberia in the midst of the Ebola epidemic in Western Africa. Finished up my career in that service after 27 years wearing a uniform, switched over to academia as the chair of preventive medicine and biostatistics at the Uniformed Services University for the Health Sciences, the military medical school in Bethesda, and then ultimately had this opportunity and took on the role of dean at the School of Public Health. Why am I telling you this story? First of all, it's not self-praise, right? I keep saying that I spent 28 years in federal service. My ego long ago was destroyed. Just kidding. But telling you that, you know, on your pathway, on your personal pathway, there are going to be many crux points, right? Decisions to be made. Do I do this? Do I do that? Do I take that opportunity or this opportunity? At times, those are the scariest aspects of my career point. I can sort of look back at 4 or 5 in rock climbing. I'm a climber. There's crux moves, right? Things that you sort of reach for. And sometimes you fall. You hope you have a safety harness and then rope to save you. And other times you make it. That's maybe where you're at right now, right? Is deciding how does public health fit into, further degrees in public health fit into your career scheme. It's scary at times. There's a lot of decisions to be made. My big recommendation right now is make a decision and go for it, right? The worst thing about decision making is being paralyzed by decision making, where you hold back and you don't try, right? They always say, you know, you're going to fall at times. Things may not work out at times. And these decisions are at times difficult. But I'm a believer in public health, and I'm a believer of what we have at the School of Public Health at the University of Maryland. What's the real high points? First of all, we are a land grant state supported institution. You know, that makes us unique in the types of students that come in and the type of faculty that serve us. That makes us unique in that we also have a massive undergraduate program, right? 2,400 undergraduates in 4 different degree paths. So you as the master's candidates, you as the PhD candidates become mentors for those students as well. We have a vibrant community, an activist community. We have diversity built into our student body that adds to our community. We also are in a very unique community. 8 miles as the crow flies between us and the Big Dome in Washington, D.C. So we have all of that. And yet we're in Prince George's County, a very diverse and dynamic community filled with the whole spectrum on the socioeconomic scale, right? And one that we partner with very closely. So we work with the feds, we work with the state public health authorities, and we work very closely with Prince George's County and our surrounding counties as well. Even when we talk about COVID-19, right? We've learned a lot about these interactions. Back in the spring and continuing to this point, our students served as contact tracers, volunteering, working in the midst of this COVID-19 pandemic with Prince George's County. Where there was a need, we continue to this day that interaction with the county. So welcome to this gathering. It's really more about Q's and A's and not my story, but I want you to be filled with what? With the enthusiasm of public health. No matter which component you want to get involved with, realize that even in these last 8 months, as our lives changed in the midst of a incredible public health crisis, right? You look at this and you sort of not only talk about the pandemic, but you talk about other public health issues that have really come to the forefront. Violence, right? The murder of George Floyd, racism, and the anti-racism movement. The idea of how do we include health equity into the conversation. We oftentimes describe this time period as a syndemic, and you can add many things, but there's the pandemic of COVID-19, there's the pandemic of racism in our society and our ability to reason now through anti-racism, diversity, and inclusion pathways. And then there's obviously the overwhelming aspect of climate change that we tackle. So there's a lot going on in public health. Welcome to this meeting and welcome to what may be the first step in this next stage of your careers. So Steve, back to you to moderate any questions that may be coming in. and I'll be happy to answer them.
Great. Thank you, Boris. So Dean Lushniak is available to answer your questions in our remaining time before we transition to the student panels. You can raise your hand in the participant button. You can add a question into the chat. Consider this the first opportunity to take that risk in your journey toward public health, right? I know it's not easy to extend yourself, but here's your chance to talk with the dean of the school.
Hi, this is Sylvia Costa.
Yes, hi, Sylvia. How are you? My name is Boris.
Good, Dean Lushniak. Thank you for sharing your background. You have a really diverse background, and just full disclosure, I graduated from the University of Maryland in my undergraduate degree in 2010. I am a high school counselor by profession and transitioning back into this public health field, and that's my I'm just kind of changing careers at this point. So I've been really inspired by your story, and I just wonder what kind of words you have to say for those who are making a career transition, and how we can get that support from faculty. I know University of Maryland have amazing faculty and staff members to support students, from my undergraduate experience, but just as someone who has not been in school for 7+ years, what is your advice in going back into the academic world and getting started?
Well, first of all, thank you for first of all taking on this role of being the first person to ask the question, because you know how it works. Oftentimes, that's the beginning of multiple other questions. So you are brave, but obviously you're also brave, which is the idea of 7 years doing what you've been doing, which is you've been obviously, and I'm going to not knowing you or what you're doing right now, right? Just by that definition of being a high school counselor. I'm not asking whether you like that job or not. I'm not asking you, where it is or how you fit into the scheme. Already, I know that there's a service orientation in your profession, right? What you do is you meet with students, you talk with them, you set them hopefully on certain options that exist out there in their pathways. This, the whole idea of public health, I believe, is as a public health practitioner in particular, is a service-oriented profession. Any way you look at it, I always describe to our students that this is a bold and noble profession, and it's about caring, right? It's about caring. It's about something we rarely talk about openly in the sciences. It's about love. It's about love of humanity. It's about love of the populations. It's about the love of the underserved. And people all the time say, oh my God, he mentioned the L word. Well, unless you come into this saying, I'm ready to take on the learning experience, ultimately to do some good with it, right? Public health is not a spectator sport. It's not something you sort of lean back, no matter which field you're interested in, that you lean back and you read about this strictly in books, that you ultimately then serve it through sort of justice intellectual capacity. It is service oriented. And I think one of the major ways of making that transition after 7 years back into the student, realize, yeah, it's going to be kind of tough to go back to the idea of 1, taking classes again, 2, studying, right? The infamous, oh my God, the tests. To this day, I still have, those stress streams occasionally and it's usually biochemistry for me. I wake up, in the middle of this dream. It's always like my biochemistry exam's tomorrow. And it's like, how did I get into this mess? I don't want you ever to feel like you're getting into a mess in this, right? And the way you do that is understand where you're heading, right? Understand that ultimately this is a pathway, whether it's extra letters behind your name that you're looking for, or whether it's a stepping stone for service to that community. It has to be, in your mind, service oriented. And that makes that transition easier. Look at the endpoint, not too far down at the endpoint, because you have to be appreciative of the things around you. The path is part of the journey. So as you look at your options out there, realize that at the University of Maryland, outstanding faculty mentors, outstanding fellow students, outstanding junior students, right? Those younger than you who play a role, outstanding staff that play a role in this existence. What I ask all of you is, if you end up and choose the University of Maryland, You have to work a little hard because I want you not just to be a student here, not to take that pathway. I want you to be part of our community, right? I want you, because that's a part of public health. It's not just sitting in classes, taking tests, doing your research. It's the idea is how do you get involved in the activism that goes on? How do you get involved in the forum that exists there, right? To speak with others, to listen, to learn. Get excited about that. And that transition, is difficult. I'm not saying it's going to be easy, but it gets much easier when you know what the endpoint is somewhat. Doesn't have to be super set. It can be out of focus a little bit, but you understand what you're getting yourself into. And secondly is that you enjoy the passageway, that it's not just, oh, I have to go through this to get what I want. Welcome.
Thank you.
Sylvia, thank you for getting the questions started. We still have some more time with Dean Lushniak for anyone who has a question.
I see from Corey is a question on Zoom chat. What is the most exciting thing that you've done as a public health professional? How would a student position oneself with such an opportunity? There's two facets, I always say, to sort of a public health practitioner's career. And certainly there's a different tempo with each of these. So when you look at, I mentioned the fact that, I wore the uniform of the Public Health Service. So I use that term deployment. We were sent out, right, to work on public health issues, usually relatively short-term assignments, but those were always, boy, they made you so alive, right, with the challenges, sometimes so alive with seeing destruction, right? There's a component to public health that, again, you can only learn so much in the classroom, but the whole issue of, for me to choose what was the most exciting thing, it's always difficult because there's two facets to it, right? When you look at the experiences, some of them painful. The aspect of seeing the worst of the world at a time of crisis isn't a pleasant scenario. But each of those opportunities, I walked away with a growth in me, right? With a sense of saying, I've seen something that I hadn't seen before, and how do I apply this? Certainly my last deployment in Liberia, right? In Western Africa. At that point, we were all volunteers out there, our public health service team. We're the only US government entity actually clinically taking care of Ebola patients. And the reality was that being the freshest type of deployment in the midst of this major epidemic of Ebola was incredibly challenging. It was scary. I was surrounded by incredible, heroic people, right, who were doing incredible work. But then I can say that occurred during Hurricane Katrina, and that occurred at the World Trade Center site, and that occurred during anthrax, right? Well, what I don't want you to think about is that public health is intriguing only during the times of emergencies, because I take that same level of enthusiasm, and when I talk about what public health is all about, so I'll take my 5 years in the Office of the Surgeon General, working on policies, working on the 50th anniversary report of smoking and health. Right, 50 years we've been battling a scourge on our society. The first report came out in '64. I was the one who issued, and my team, the 50th anniversary report in 2014. And the reality was, in those 50 years, we had made incredible progress, and yet we still have a problem, right? A problem that kills an incredible number of people worldwide, right? And so it's really what intrigues me most, and the exciting thing about public health is our challenges are always there. Secretly, the unfortunate thing is we're never done, right? We're never done. I mean, look at everything that's going on in COVID-19. That opens up many more new opportunities. So I would say the most exciting thing I ever done was actually ultimately stepping into the field of public health, because the challenges are there. They will continue. As I mentioned, I'm so happy and proud to be part of a bold and noble tradition. And to me, public health, I always go back to C.A. Winslow's definition of public health from 1921. It's about the 3 Ps: preventing disease and injury, promoting health and well-being with the goal of prolonging a high quality of life. What a mission. And that's what I get excited about, is the mission. Thanks for that question, Corey.
Excellent. We will give the last question to Harper Eisen.
Hi,
Hi.
my name's Harper. I just like to thank you for sharing your story. It really resonated with me, especially when you said that the University of Maryland was an activist community, because I consider myself very much an activist. I'm just wondering what kinds of things are students or you specifically involved with that are aiming to help change things in this country or worldwide?
So let's start even with some of our student-run organizations. I'm going to profile two of them. Initially called Public Health Without Borders, then they now had to change their name. Steve, or Britt, Public Health
Beyond Borders.
Beyond Borders. Okay, the Without Borders became. So we have a student organization that basically has focused on the global health realm, right? Sort of a unique aspect to this in that it was built upon another organization called Engineers Without Borders, right? Where engineers would go out, students, usually at the undergraduate, but also at the graduate level, would become part of a group on campus, come up with projects, make the alignments with other communities across the globe, and go out not just as a tourist experience, but as an educational connectivity, right, that goes on. And yes, ultimately culminates with different regions of the world and our students going there. Highly recommended for everybody. It's definitely, run by students. We have faculty moderators or assist, but this is a great organization that gets our students into the realm of public health in the global scale. That's one example. The other organization that I would say we started putting together in the last 3 years, ever since, I sort of realized we didn't have an organization on campus that dealt with the issues. Yes, they're global health issues, but they're issues relevant to us. And I think all this stemmed from one, and it's silly for me to say, is I don't even remember which mass killing this resulted from. That's how sad it is, because, we've had a history of them. And yet my rage, and what I ended up doing is with our faculty and staff holding a town hall meeting. And I said, we can't just sit back, right? I mean, all of us go through that, right? We formed an organization, again, student run, called PHACE, P-H-A-C-E, Public Health Action for Civic Engagement, right? And the idea is, how do we get involved? How do we get involved politically with Annapolis? That's our state. How do we get politically at the national level? How do we get our students to discuss things? And Harper, part of the problem tends to be is we have to be very careful. We're a state-based educational institution, and I can't necessarily go out there and be super partisan in this, right? I'm trying to make sure that my students become thinkers. I'm not telling you how to think. I'm just telling you, think, right? I'm not telling you how to vote. I'm telling you how to vote, or telling you to vote. In this organization, part of it is the exchange. And early on, I remember when we talked about gun violence, that one of our students basically said is, listen, I come from a rural part of Maryland. My family has always been a member of the National Rifle Association, right? This is what I grew up with. But I'm wanting to talk. I want you to understand where I'm coming from. I didn't spend my effort to change his mind. That's not my job. My job was to make sure that you as a student are exposed to other ideas and thoughts, right? The worst thing we can possibly do is just surround ourselves with people like us. The worst thing we can also do is to make everything a spectator sport, right? I don't want that in the School of Public Health. And frankly, I don't want that in my students. So to all of you, unless you are ready to step out of the mode, right, of just being a student, I don't have time. Time is always a problem. Many of you may be still holding other jobs where you're doing this, but just give me a little. Make your education more than taking a test. Make your education more than just sitting in the classroom. Great question, Harper.
Thank you.
Great. Thank you, Harper. And thank you, Dean Lushniak, for your time today.
Good. I'm really sorry I showed up late. So I know you're on the schedule and we're 4 minutes behind, but happy to be part of this. And I'm also available. So if anybody wants to send me an email, it's Lushniak, my last name, Lushniak @UMD, University of Maryland.edu. So if you have any follow-up questions, that's been part of my style, as both Britt and Steve understand and know, is I'm kind of the accessible dean, right? I can't answer all your questions, or where I need to, I'll refer you. But on the other hand, you know, I'm out there, I'm available, and I'm more than happy to share my enthusiasm of the whole public health field. So consider us. I know you have many, many other choices out there. You know, we're a young school of public health, going on 14 years since our existence. And yet embedded in that are departments that have been around for over a century, 125, 26 years in kinesiology right now. We are very varied in our approach in public health. Maryland Center for Health Equity. We work on the you know, aspects of with our Horowitz Center for Health Literacy. We work on environmental health, epi, biostats, family science, kinesiology, exercise, its role in things. We have our public health science program at the undergraduate level. And you know, and obviously health policy and management, right, as one of our key features. I'm really happy that you're considering us, and you know, if it's a fit, join us. If it's not, I hope you at least realize that public health in general is a great field to get into. So thank you so much, Britt and Steve. Thanks for having me on.
Great. Thank you, Boris.